Have you ever noticed unusual changes inside your mouth? Perhaps a persistent sore that just does not seem to heal or feels different from a typical canker sore. Understanding these subtle signs can be a helpful step in managing certain health conditions. Lupus mouth sores, often referred to as oral lesions or discoid lupus lesions, typically appear as painless or mildly uncomfortable patches inside the mouth. They commonly show up on the roof of the mouth, known as the hard palate, the inner cheeks, or the gums. They can sometimes be mistaken for other common mouth irritations, but they have distinct characteristics that set them apart. The presence of these sores is a significant indicator of lupus activity, especially in systemic lupus erythematosus, a condition where the body's immune system mistakenly attacks its own healthy tissues. The immune system's overreaction causes inflammation that can lead to these distinct sores on mucous membranes, which are the moist linings of the body. Unlike common canker sores that are often round or oval and quite painful, lupus sores might be less painful initially and can have a more irregular, red or white appearance, sometimes with a distinctive red rim or a white lacy pattern. If you notice persistent, unusual sores in your mouth, especially ones that do not heal within a couple of weeks, it is a good idea to schedule a visit with your doctor or a dentist who has experience with systemic conditions. They might perform a thorough examination, which could include looking at the specific location and appearance of the sores, and potentially recommend a biopsy if there is any uncertainty. Describing when they started, whether they are painful, and if you have other symptoms can provide valuable information for diagnosis. One interesting detail about lupus mouth sores is their association with discoid lupus erythematosus, a form of lupus primarily affecting the skin. When these discoid lesions appear in the mouth, they can have a similar appearance to the skin lesions, often with a white, lacy border or a reddish center. Recognizing these specific patterns can be a key clue for healthcare providers, helping them to differentiate lupus sores from other oral conditions like fungal infections or lichen planus, which can look similar but requiring different treatments. Being aware of these subtle but important characteristics of lupus mouth sores empowers you to be an active participant in your health. Noticing and reporting these kinds of symptoms to your healthcare provider can help ensure timely identification and management, supporting your overall well-being and helping you confidently navigate your health journey.